Okay, whatever you say. But it is a pleasure to be here, and I'm happy to talk about 3 initiatives that we have to better understand the burden and care of living with and caring for people living with spinal disorders. And we're starting small. You know, the Ministry of Health wanted us to do national surveys, national interviews. We're starting in Shoshone, Mahalape, and we hope to expand in future years. So, as you've heard from Scott and Margarita, Lindsay, Joan, earlier today about the healthcare resources in developing countries, and this is not news to you. What you've also heard today as a consistent message is that there is not only insufficient data or little data, that the data that does exist really doesn't describe, you know, how, where, what are the contexts that people actually seek and find relief for musculoskeletal conditions. Now I'm having trouble with the flat pad. So the 3 projects, one is longitudinal data collection. How many, outside of the World Spine Care research team or team that we have here today, how many of you are researchers? How many of you have ever participated in a research project as a clinician or healthcare professional, allied healthcare professional? Okay, small group of hands. So of those of you who have participated, what was it like working with the researchers? Was it easy? Was it seamless? Or did you find that you had to find compromises between the clinical routines that you had going and what the researchers came in and wanted to do? Was it easy? Was it seamless? Sometimes it can be challenging. Pardon me? It's not easy. I will agree with that. Sometimes it can be challenging, but it's also the fun part. And we have such a wonderful opportunity. 25 years I've been involved in clinical research in chiropractic and doing small, couple hundred patient clinical trials in small settings. Here, we started a new business, basically, right? We have 2 clinics going in Mahalape and Shoshone. And from day one, we're collecting clinical data, and hopefully it goes on like what we refer to the Framingham study in the U.S. that it was a large cohort study started back in I think the 50s and 60s and is still going strong today. The second study is actually part of my doctoral work, the qualitative study that I'll talk to you a little bit about, the focused ethnography. All of it feeding into what we want to do. What Scott wanted me to do 3 years ago was we're going to charge in and we're going to do a cross-sectional epidemiological study. We're going to survey everybody in the village in Shoshone. That needs a little money, and what I think the first 2 studies to help inform the cross-sectional study that we ultimately want to do. So again, we have this rich cohort of patients in 2 facilities, the Mahalape District Hospital, the Shoshone Primary Spine Care Clinic. And from mid-January to mid-March, we had a volunteer here from Canada, Michelle Boyle, who did a lot of work with Jeff and the other staff, both in Shoshone and Mahalape, to establish systematic data collection protocols, data libraries, data transfer systems, so that what Jeff presented earlier today were descriptive statistics. They're great. That's great information. What we would like to do is to do this and be able to kick out real-time reports, if you will, to the Ministry of Health, to any local wards that want this information about the burden of living with and caring for people living with spinal pain and other musculoskeletal conditions. So, maybe even more importantly is the opportunity for cross-cultural comparisons. I don't know that anyone has ever described the musculoskeletal problems in Botswana, and this is a start. We can pull it off here in 2 villages or a village and a district hospital level. Then I think that the sky is the limit for us in Botswana. So the Ministry of Health Human Subjects application is in process right now based on the work that we've done over the last year and a half. And we're going to ask to retrospectively review all of the patients that we've collected data and seen to date, and systematically analyze those data and prepare them for reports. And going forward, training people on the ground. Who are the local workforce who want to join us in this effort to systematically review the data going forward in time, so that we, every year, every other year, we have information to provide people who ask. So the qualitative study, I don't know if any of you have been involved, but the approach that I'm taking is a focused ethnography, which brings in anthropological theory and methods, but it limits the scope and duration of fieldwork to specific program relevant areas, but also logistically specific blocks of time. With the other commitments, and I didn't completely give up my job, but I did go to half-time position in the US and full-time position in Denmark, so I have some other responsibilities and cannot be here on the ground for 2 or 3 years living with and working with the people in Soissons. But this methodology, if you will, this focused ethnography, it's an important approach when you want to understand the meanings that people attribute to particular life events, what they give to health and illness, and to do it in particular blocks of time. So the broad aim of the doctoral program is to examine the cultural, social, clinical, and organizational characteristics for the burden of living with and caring for people with these conditions in Soissons. And the way I will do this is by participant observation. I will stick out like a sore thumb. I don't know if that's a phrase in Setswana, but white woman with a stick. But I'm gonna get out there and get involved with community events to the extent that I can. Get out to the lands, get out to the bush, and go to the HIV clinic on Mondays, and interview people, individuals, small groups, villagers who have and have not attended the World Spine Care Clinics, the providers who are providing service at the World Spine Care clinics, and as well as the health posts, to help us better understand what is important to people in their daily lives for living with these conditions. More than just how much is your pain on a scale of 0 to 10? Well, it's a 5, it's a 10. What does that mean? How does that impact your life, your ability to work or not work? So, I'm here for the next 3 weeks and hope to continue to build relations. I have 2 sets of 7 documents that have been translated from English to Setswana by 2 different people who really don't know each other. Now I'm looking for 2 people to back translate those documents from Setswana to English. And by using this methodology, I hope to understand more myself that it depends where you're from and how you take a phrase in Setswana and translate it into English. And what kind of cultural context do I have, or did I lose? Because I'm not fluent in Setswana yet, this is going to be extremely important for me to understand as I go forward with this project. Building contractual arrangements with people who are interested in the research process and in being an interpreter and translator for me for interviews where the person speaks no English and absolutely has to do it in Setswana. So these are the things that I'm looking to do over the next few weeks. And you know, the Ministry of Health, assuming that everything sails smoothly and I can submit the application at the latest by June, that hopefully primary data collection will happen in October, November this year, as well as about this time of year, April, May in 2014. So at your next annual conference, I hope to have some data to present to you. Beyond that, it's about preparing manuscripts, making sure the appropriate acknowledgments and authorships follow the guidelines that we're used to in the research world, and not leaving anyone behind. Once we have systematic data in our clinics and we have the qualitative, the stories that people tell about the burden of musculoskeletal disorders in their lives, we hope that these will inform the questions then for the cross-sectional household surveys, so that when we go out to interview 3,000 to 4,000 people in Shoshone who are still at home, that we're asking questions that are meaningful to describe the prevalence and the burden of disorders in the community. That's going to take funding. That's going to take a fleet of people. Carolyn and Vanessa have left, had to get back to Cabron here this afternoon, but I worked with them 1.5 years ago, and we estimated that to interview 3,500 to 4,000 people in Shoshone, we would need at least a workforce of 12 to 15 people and 3.5 to 4 months time, 7 days a week, working with training and sending the interviewers out every day to interview households. And that's a good opportunity for short-term employment, maybe not long-term, but hopefully the value of learning about research techniques and data collection and feeling involved in the community in building what we hope will be a sustainable partnership between folks here in Shoshone and Mahalape, World Spine Care, the Ministry of Health, and your country. So, bottom line, all 3 of these projects, we hope to describe the prevalence and burden of musculoskeletal disorders. We want to estimate the numbers and types of providers that we'll need to serve the community going forward in time. We believe that the information we collect will help inform public health policy for these strategies that will improve quality of life and the ability to work. And as always, and as you've heard all day today, incorporating community values into sustainable partnerships is something that is one of our underlying principles. I have many people to thank for being here today and spending time on the ground. The Ministry of Health, World Spine Care for making this happen. The Danish Chiropractic Research Foundation, which funded me for a generous amount to do my doctoral program. University of